today I'm going to show you some oxygen devices that we can utilize. Say for instance, a physician has ordered 3 liters of oxygen on a patient. You are going to check that patient's chart. You're going to go to their room and explain what you're doing with the patient, that you're from respiratory care, what you're doing. First, as far as setup, you're going to make sure you have the necessary things. You have your oxygen wall source here. You have your flow meter with your nipple adapter. So you would explain to the patient how you're just connecting your supplies. So we would attach the flow meter to the wall, and then we would attach our nipple adapter. And then this patient was going to be on 3 liters, so we'll set that to 3 liters to make sure that there's no leak. We don't hear anything leaking right now. We'll go ahead and set that to our 3 liters. And we see that ball is floating at that 3 liters. Make sure we feel that air coming through, and we do. So then we will attach our tubing. This is our nasal cannula tubing. So we have our end that attaches to the source, and then our end that attaches to the patient. We would explain to the patient that the prongs go in either nair. We would put the prongs in each nair here, and then we put the extra tubing around either ear, and then secure it, not too tight of a fit, or just snug enough that it's not going to fall off the patient with this little adapter here. So we would attach this tubing to that nipple adapter, and then we're going to move that to 3 liters, and then we would place on the patient. We would make sure it's a comfortable fit for the patient. If they're having issues or it's getting sore behind their ears, we can maneuver some things, but we want to monitor the oxygen level before, during, and after placement. We're hoping to see an increase in that oxygen level and remove the oxygen when we're able to. And we want to make sure that we feel that oxygen, we can hear that oxygen coming through those nasal prongs there. So that is the nasal cannula.